Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island. And today I wanted to talk to you a little bit about alternative treatments for the vasomotor symptoms of menopause. So these are non-hormonal treatments. And remember that the vasomotor symptoms, or VMS, include things like hot flashes, night sweats, and the insomnia, mood changes that they can lead to. Of course, hormone replacement therapy has received a lot of coverage in the news these days and in various forms of social media and so forth. And it can really benefit a lot of women as they go through this time period. However, it's not appropriate for absolutely everyone. A patient may simply elect not to go in that direction in terms of treatment of VMS, but also it's contraindicated in certain patients as well. And I chatted with you all a little bit about that on other videos. So let's talk for a moment about the non-hormonal treatment of the vasomotor symptoms of menopause. So one that's been kind of a standby, meaning something we've used a lot over the last couple of decades, especially when HRT went out of favor in the early 2000s. And again, pendulum has swung back in the other direction as we've reinterpreted those studies and also, of course, collected more data from other studies. But the medicines I'm referring to here are antidepressants of the SSRI or SNRI classes, so selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors. In terms of what's actually FDA approved among the SSRIs, that would be paroxetine. However, others may work as well, and it doesn't necessarily need to be FDA approved for this particular indication. We do this quite often in medicine. The medicines are safe. They're FDA approved for other things like anxiety and depression in this case, but they also happen to work in this arena with vasomotor symptoms. So a couple of the others are escitalopram and citalopram. So those are the three major ones that we often use in the SSRI class to treat the vasomotor symptoms, although it's possible that others, such as sertraline, which is could work as well. As always, I have no financial interest in any of these particular medications that I'm going to discuss with you today. In the SNRI class, venlafaxine and desvenlafaxine can be really helpful. These are really commonly used anti-anxiety and anti-depression medications. They can be fairly effective. Now there are a number of other oral medications that can be used. One is gabapentin, which is often used for nerve pain or in patients that might have issues with seizure, but really commonly used for neuropathic pain from diabetes and things of this nature. It can be helpful in this regard with the VMS symptoms, but it can cause some weight gain, and it also can make you a little sleepy. So if you were to take it at night, not so much of a problem. If you have to take large doses and take it through the day, the drowsiness could be a problem, and so could the weight gain. Another medicine is oxybutynin, Berger, which is often used to treat overactive bladder. It can be used for the VMS symptoms too. We like to use caution in older folks. It can potentially be involved with cognitive decline in elderly patients. New kid on the block, a new medication is called fezolinetant, or Veozah is the brand name. This is a new class of medications to treat vasomotor symptoms. It works by basically antagonizing a kind of receptor called neurokinin B, or I should say a neurotransmitter, I suppose, called neurokinin B. And that creates a cascade in the thermoregulatory center of the brain to basically control the hot flash type symptoms and night sweats by controlling the thermoregulatory center in the brain. So it can be quite effective. It is a brand name medication still on patent, so price could potentially be an issue for folks who don't have coverage with their insurance, but fezolinetant, a new medicine that can be very effective for the vasomotor symptoms. So let's talk a little bit about lifestyle and supplements and things like that, because there are a lot of things on the market that are supplements, and remember that supplements are not regulated like medications. Supplements are regulated like foods, and so the manufacturers don't need to prove two things: that there's a particular amount of the so-called active ingredient in them, and also that there aren't lots of impurities. They don't need to prove all of that like you would with a pharmaceutical. So in general, there really isn't strong data for any particular kind of supplement. Now, if something happens to work for a person and it seems to be otherwise safe and so forth, I won't necessarily be against its use, but in general, the medical literature, the data that we have, are not in support of any particular dietary sort of supplement that you might be able to purchase. There are a number of other kinds of lifestyle modifications, I should say, that although they're really healthy for lots of other reasons, don't seem to really help folks with VMS. And basically these are exercise, yoga, acupuncture, cannabinoids, so things derived from cannabis, marijuana, and getting back to supplements and foods and whatnot, soy products, which can affect estrogen, increase estrogen perhaps slightly, don't seem, as far as the data and research go, to be all that helpful, and that includes the soy metabolite equol. So again, while I'm certainly not against people eating soy. I think it's a great way to get protein and decrease animal protein intake. In terms of VMS, it doesn't really seem to be all that helpful. One thing in the lifestyle arena that has been shown to be helpful, and of course it's great for many, many other health reasons, is weight loss. So whether you're doing that just by lifestyle alone, or you're doing it lifestyle plus a medication, and of course I've chatted with you all an awful lot about different weight loss medications and their benefits and potential side effects and things of this nature. But weight loss in general can be helpful with VMS. So something to bear in mind. And of course, if a person has a weight problem, lots and lots of health reasons that it would be beneficial to normalize their weight. Another technique that is kind of on hold until further randomized controlled trials are done is something called the satellite ganglion block. These are collections of nerves located around the cervical spine that are involved in carrying signals up to the brain, so what we call sympathetic or fight or flight kind of signals up to the brain, including that thermoregulatory center that seems to be what controls or can cause these hot flashes. Now, it's kind of in the midst of being tested out. There is a rare risk of seizure with it, and there are ongoing trials to investigate satellite ganglion block. So basically, in women who have VMS and really are bothered by their symptoms, a lot of non-hormonal options for them, including antidepressants, oxybutynin, gabapentin, and the new medication fezolinetant, Veozah, which can be really helpful for folks who either shouldn't take hormone replacement therapy or elect not to do so. Now, bear in mind that everything I share with all of you in these videos is for educational purposes only and does not constitute medical advice. We have not formed a doctor-patient relationship. And if you have particular questions or concerns, you should not hesitate to reach out to your medical professionals. If you would like to learn more about the care that we offer in our concierge-style practice here at Northeast Medical Practice, you can reach out to the office, 516-604-3411, or you can contact us via the website, northeastmedicalpractice.com. Of course, we are on all of the various social media channels. We have a YouTube channel, and you can also check out my podcast called Longevity MD on Spotify. But until we see each other next time, be in good health.